Marijuana use can have various effects on the brain and cognitive functions of workers, depending on the frequency, duration, and potency of use. In this section, we will explore how marijuana use affects the brain and cognitive functions of workers in the short term and long term. Short-term effects of marijuana use on the brain and cognitive functions of workers. Marijuana use directly affects brain function, specifically the parts of the brain responsible for memory, learning, attention, decision-making, coordination, emotions, and reaction time. Marijuana contains a chemical called tetrahydrocannabinol, THC, which is responsible for most of the psychoactive and potentially addictive effects of marijuana. THC interacts with receptors in the brain that regulate various neurotransmitter systems, such as dopamine, serotonin, and glutamate. When workers use marijuana, they may experience an immediate impact on their thinking, attention, memory, coordination, movement, and time perception. This can impair their ability to perform tasks that require concentration, problem solving, planning, organization, or multitasking. For example, workers who use marijuana may have difficulty remembering instructions, following directions, completing assignments, or meeting deadlines. They may also make more errors, have slower reaction times, or have impaired judgment or decision-making skills. These effects can compromise their productivity, quality of work, safety, and performance. The short-term effects of marijuana use on the brain and cognitive functions of workers depend on several factors, such as the amount of THC in the marijuana product, the concentration or strength, the method of consumption, smoking, vaping, eating, the individual's tolerance and metabolism, how fast the body breaks down THC, and whether other substances, such as alcohol or tobacco, are used at the same time. The effects can last from a few minutes to several hours after use. Long-term effects of marijuana use on the brain and cognitive functions of workers. Marijuana use can also have long-term effects on the brain and cognitive functions of workers, especially if they start using marijuana at a young age or use it heavily, at least weekly, for several years or more. Long-term marijuana use can affect how the brain develops and functions in adulthood. Studies have shown that long-term marijuana users may have lower IQs, reduced learning abilities, slower processing speed, and deficits in memory and attention compared to non-users. Long-term marijuana users may also have smaller hippocampi, the region of the brain responsible for learning and memory, than non-users. These effects may persist even after stopping marijuana use or controlling for other factors that may influence cognition, such as education level, socioeconomic status, or other drug use. Long-term marijuana use can also affect workers' motivation, mood, and mental health. Some workers who use marijuana long-term may develop a cannabis use disorder, CUD, which is a condition where they experience withdrawal symptoms when they stop using marijuana or have difficulty reducing or controlling their use despite negative consequences. CUD can interfere with workers' personal and professional lives and increase their risk of developing other mental health problems such as depression or anxiety. The long-term effects of marijuana use on the brain and cognitive functions of workers are not fully understood and may vary depending on individual differences and environmental factors. More research is needed to determine how long-term marijuana use affects the risk of developing dementia or other neurodegenerative diseases in later life. Summary: marijuana use can have short-term and long-term effects on the brain and cognitive functions of workers. Short-term effects include impairments in memory, learning, attention, decision-making, coordination, emotions, and reaction time. Long-term effects include lower IQs, reduced learning abilities, slower processing speed, deficits in memory and attention, smaller hippocampi size, region responsible for learning and memory, cannabis use disorder, CUD, reduced motivation/mood/mental health. The effects depend on several factors such as frequency/duration/potency of use, age of first use, method of consumption, individual differences, environmental factors. Marijuana use can have serious implications for the safety and health of workers and their coworkers. In this section, we will explore how marijuana use influences the following aspects: Psychomotor skills and cognitive ability, risk of accidents and injuries, workplace performance, and productivity, legal and regulatory issues. First, let's look at how marijuana use affects psychomotor skills and cognitive ability. Marijuana is a psychoactive substance that can impair judgment, concentration, memory, learning, decision-making, and reaction time. These are all essential skills for performing safely and effectively in many jobs, especially those that involve operating machinery, driving vehicles, handling hazardous materials, or working at heights. Studies have shown that marijuana use can cause sedation, disorientation, and slowed fine motor skills, which can contribute to delayed decision-making and impaired learning. Second, let's examine how marijuana use increases the risk of accidents and injuries. Marijuana use can impair the ability to perceive and respond to hazards, which can lead to fatal or non-fatal injuries. One study reported that employees who tested positive for marijuana had 55% more industrial accidents, 85% more injuries, and 75% greater absenteeism than those who tested negative. Another study found a statistically significant association between marijuana use and increased risk of motor vehicle crashes.